Hello, everyone. So, in this session today, we are going to be talking about diabetes management with Gwen. Gwen is a licensed practical nurse and she is a diabetes educator approved by CDC. Welcome, Gwen.
Thank you for having me, Armida. It's a
Yeah,
pleasure to be here.
pleasure is ours. So let's just understand diabetes is like such a big topic, right? And we are only going to talk for like 10-15 minutes today. So now, diagnosis. How do we diagnose you have diabetes?
Diagnosing diabetes can be as simplistic as a blood test. Usually, physicians will ask for a sample of blood every 3 months, which is 90 days, which allows the 90 days our red blood cells to regenerate. And that test is called the hemoglobin A1C. And what it is defined by is an average of our daily blood sugars, blood glucose, over that 3 month period of time, over that 90 days. And that gives the doctors an average, the hemoglobin A1C, which can range anywhere from like 4 on up. Of course, we want to stay somewhere between 4 and 7, and depending on the person and their medical history and family history, they may receive the diagnosis of prediabetes or diabetes.
So let's explain the range between the pre-diabetes, diabetes.
The pre-diabetic range is on the lower end. So we want to think between 4 pushing 6, just a little bit, but there are also several factors with that. And anything raising above that 6, we also want to consider the other factors. So medications, steroids, stress, infection, any autoimmune disease, pancreas. What is our pancreas actually doing? How healthy is our pancreas? Those are some of the things that the physician should be looking at, and most definitely nutrition. How are we eating? Are we being active? Have we gained a couple of pounds, especially around our abdominal area? All of these pieces of the puzzle put together will assist the physician in coming up with a diagnosis.
So, what is the main cause of diabetes?
So I must say, and thank you for asking that question, because so many people are miseducated and say that because the person is lazy or because they eat so much sugar or drink soda. None of those things have anything to do with the cause of diabetes. For some persons, such as children, we used to call it juvenile diabetes, but now we call it type 1 diabetes. This diabetes is caused by our bodies. Literally, our pancreas is not functioning properly, our beta cells are not working, our body is not producing insulin to make use of the sugar that our body is taking in. Hence, we have diabetes type 1. Type 2, we are producing insulin, but our body is not using it correctly, right? So this can happen over a period of time. These are the persons that are able, if they are diagnosed as pre-diabetic, to avoid the diagnosis of diabetes type 2. What we are seeing is diagnosis of diabetes type 2 in children such as 10 and 7 years old because of how our society has changed. Next, we have gestational diabetes. Gestational diabetes is brought about because the placental hormones are not accepting of the insulin. It causes the insulin not to work as it should. So we have gestational diabetes. Last but not least, we have late onset adult diabetes, which is highly misdiagnosed. This diabetes is from our system, autoimmunity, nothing else. I have heard of persons having a virus, their pancreas was attacked, and they leave the hospital as a diabetic. We have to be clear in our communication with our physicians so they can understand what is actually going on with us, our signs and our symptoms, so we can receive the proper diagnosis. There are a lot of patients that are the late onset adult diabetic that are receiving the improper diagnosis and being treated wrongly, which, as we both know, can cause damage over the long run.
Sure, and talk to us a little bit about complications, right? If
Yes.
with diabetes, there's all kinds of amputation that can happen with the legs or something else, right?
Yes, no matter what type of diabetes you have to be careful. Diabetes affects each and every body system, from your hair to the sole on your feet and everything in between, especially your heart and your vascular system, and kidneys. All of these things are important to monitor. So when you check your blood sugar, it's good to keep record to know your number, right? When you know your number, you know what your body can tolerate, and then you can start to look for changes in other areas. Most definitely, diabetics want to monitor their limbs, not only for discoloration, but for numbness, tingling, pain. This summertime, a lot of people may be going outside without their shoes. They may be going to the beach without their shoes. If you're a pre-diabetic or a diabetic, it's very important that you have a covering on your foot because you don't want to have an injury to your foot that could turn into a wound. Elevated blood sugar will cause you not to heal properly, which could turn into dangerous tissue, if you will, necrotic or gangrene tissue, and then possibly an amputation. We also want to be mindful of our blood pressure while we are diagnosed as diabetics. And I don't know if I said that appropriately, but blood pressure is key. Because we have the extra blood sugar running through our veins and our vessels, sometimes a little sludge, if you will, which is actually sugar that is lipid, the fat, will build up in our veins and our vessels. This will contribute to loss of blood flow or small blood clots that could cause other injury to our bodies.
That's very scary. That's really, really scary. So let's come to management, right? What can we do to manage this?
Managing diabetes is very dependent upon the person and relationship that they have with their practitioners. And I mean practitioners. We want to have relationship not only with our primary doctor, but also cardiology, podiatry, ophthalmologist. There are so many specialties that help manage. Any person that is diagnosed as a pre-diabetic or a diabetic should be referred to a dietitian, right? Because this is where we can pick up some of the slack, if you will, with nutrition and helping us to control our blood sugars. What we put in our bodies makes a big difference. If we start out in baby steps, mind you, putting the right thing into our body, we can ward off some of the complications. Our management may be easier, but it's also a mindset thing. It's a hard diagnosis to accept. I'm a diabetic. I may have to take a needle for the rest of my life, or the doctor wants to give me metformin, and that makes me sick. So, what do? I can't go out with my friends or my family. I have to eat this, I can't eat that. It's a lifestyle change and it is hard. But with the proper support system and mindset, it is most definitely achievable. And again, I encourage people to make baby steps. I encourage people to journal. And if your practitioner is not giving you the referrals that you need for your success in your diabetes, please ask for them. Most definitely a dietitian, a podiatrist, ophthalmologist, and maybe eventually a cardiologist and a nephrologist. But dietitian, ophthalmologist, and podiatrist should be your first three referrals, no matter what. They can help you along the way because diabetes will affect everything else eventually, but those three are very key and important.
So tell me that, can you reverse if someone is pre-diabetic, can they reverse it?
So as a nurse, I hate to say that something can be reversed because I do know clinically that diagnosis is always with them for the rest of their life on paper, right? Because of insurance. So, what I do like to say is that it can be well controlled, it can be put in remission. We can do better by ourselves with, again, the proper tools, the encouragement, the lifestyle changes that lead to our health success. And
So
the other key is that once you are diagnosed with an illness, your physician will continuously follow up for that illness, even when that illness is in remission. So that's why I don't like to use the word reverse, because I would hate for someone to say, I was told that my diabetes was reversed, so why are you checking me for it?
So it can be managed with diet and what else? Exercise?
Exercise, yes. 30 minutes of exercise every day. That's about 150 minutes a week. And for some persons, we know that everyone can't do the same thing. Walking is something most people can do, but you can always ask your physician for a referral to physical therapy to give you exercises if you can't walk that you can do in your home that are comparable for you so you can still get in your 30 minutes every day.
And what about the carb counting part, when you're eating?
So the carb counting part, that is most definitely patient specific, depending on their weight, their height, and everything else, their likes and their dislikes. I encourage persons to eat foods from the low glycemic index, foods that don't have as much natural occurring sugars, and foods that have properties such as antioxidants or anti-inflammatory properties, right? Um, Carb counting is a learned skill for everyone. It's not something that you can just say, hey, count those carbs and you will be okay. No. When you count carbs, yes, you still do have to check your blood sugar. You still do have to monitor the insulin if you are taking any, and the effect of that insulin while you are carb counting.
Wow. So maybe you can tell us some of the foods, 3 or 4 foods or herbs that we should focus on that have low glycemic index.
So berries usually, that's one of the big ones. Berries usually are low glycemic. Not only are they filled with nutrients, but they're also filled with water, right? Diabetics need water to help push some of that extra blood sugar out. Also, avocados. Avocados are filled with not only fiber, but healthy fat. Again, push the extra blood sugar out. We also have the fatty fish, the omega-3, such as salmon. You can cook it many ways and have it still taste good to you and get the nutrients that you need. And not only is it good for diabetics, but it's also good for heart health as well. Of course, green leafy vegetables, because they provide not only vitamins and nutrients, low glycemic index, but they have the fiber as well to push out the extra blood sugar.
So the idea is to push the excess blood sugar out of the body. That's
Yes, yes.
And what about resistance training? There's a lot of research that talks about resistance training is good for diabetes.
Yes, resistance training, I it's good basically for anyone, right? Because we are building our bodies up,
Mhm.
and we are building muscle at the same time, which we are burning, getting rid of the extra fat that our body does not need.
Hmm. Well, thank you so much, Ben, for giving us a sneak preview on what people can do if they have pre-diabetes or diabetes. Anything else you would like to add before we wrap up today?
I would just encourage everyone, if you know a diabetic, if you are a diabetic, please share your status as a diabetic, because there are so many situations that people find themselves in and they feel uncomfortable to say that they are a diabetic. But just like you and I, they have lives that are full and they want to be treated evenly, just like everyone else does. No one is lazy, and it's not because of what they ate. They didn't ask to be a diabetic. Nobody asked to be a diabetic. It's something that happened. It's something that can be worked on. But make your status known just in case you get into that incident that your blood sugar does drop or elevates highly. Someone can get you the assistance that you need.
Thank you so much, Gwen. The message is here for today's session. You can manage your diabetes, right? We're not using the word reverse, but the management of the diabetes can be done through lifestyle modifications, dietary changes, some exercise, and some other simple changes that you can do, right?
Yes, lifestyle changes for the win.
All right, great. Well, thank you so much, Gwen, for being with us today and sharing this uh, amazing information. Thank you.
Thank you.